We're at an exciting time in the treatment of the heart in children with Duchenne's muscular dystrophy. We have a lot of research that has been done in the treatment of adult hearts that we now can apply to children with Duchenne's muscular dystrophy. We know that looking at the heart early in the disease will help us identify a heart that is not working well sooner than we have in the past. Identification of a heart that isn't working as well can be treated earlier. This will hopefully lead to improved quality of life and quantity of life. The heart is one of the body's most important muscles, and we know that in Duchenne's muscular dystrophy, in addition to the skeletal muscle, the heart muscle is affected as well. This is important in the care and the treatment of children with Duchenne's muscular dystrophy because we know that in the late teenage years, the cardiac function or the ability for the heart to do its job will become a major issue. So during the entire course of the child's care, from the minute the disease is diagnosed, we need to start thinking about the heart and how we can help it work to do its job effectively and efficiently. There are many signs and symptoms to watch for that a parent can look for in a patient with Duchenne's muscular dystrophy. One of the major signs and symptoms, especially after the child has become wheelchair dependent, is for fatigue to develop. Any change in the ability to tolerate the day's activities should be brought to the attention of the child's physician. Also, any development of swelling is important to note. If the child complains of a fluttering in the chest or chest discomfort, that should also be addressed immediately. In Duchenne's muscular dystrophy, there are several tests that will be ordered by your physician in the evaluation of how well the heart is working. Three very commonly ordered tests include the electrocardiogram, often referred to as an EKG, an echocardiogram, and a Holter monitor. The electrocardiogram is a test done by placing multiple small stickers on the child's chest. This allows us to get an electrical picture of the heart, which allows us to assess the health of the electrical system. An echocardiogram, the second test, is a test which is an ultrasound of the heart. This allows the physician to look at heart function to determine whether the heart is squeezing and relaxing well. It also allows us to measure how large the heart is, which will be important in assessing the health of the heart. And the third test is a Holter monitor test. Once again, we're looking at the heart's electrical health, but we are looking at every single heartbeat that the heart has over a 24-hour period of time, making sure that there are no abnormal beats present. Once the heart has been diagnosed as not working properly, we next move to treatment and potential therapies. The first line of therapy is through the use of drugs. There are 4 different categories of drugs that can be used to treat heart failure, the heart not working as well as it should in children with Duchenne's muscular dystrophy. The first group of medications would be known as the cardiac glycosides, often referred to as digoxin. Digoxin is a drug that helps the heart squeeze better. The second group of drugs that are used in the treatment of a heart that is not working as well as it should would be the diuretics. In this category of medications, some of the commonly used drugs would include Lasix and hydrochlorothiazide. These drugs work in eliminating fluid from the body. When the heart isn't working as well as it should, the body accumulates excess fluid, and these medications help remove that excess fluid and help the heart squeeze more efficiently. The third class of medications are known as angiotensin-converting enzyme inhibitors, often referred to as ACE inhibitors. These include medications known as lisinopril, enalapril, and captopril. And what these medications do is lower the blood pressure. And by lowering the blood pressure, you allow the heart to squeeze more efficiently. It's as if a weightlifter was no longer lifting 100 pounds, but was now lifting 50 pounds. The fourth type of medication that can be used to treat a heart that isn't working as well as it should is a group of drugs known as beta blockers. Atenolol or propranolol are included in this classification of drugs. Beta blockers have been shown to work very well to treat a heart in adults that is not working as well as it should. They have not been investigated extensively in the treatment of a heart that isn't working well in patients with Duchenne's muscular dystrophy. We need to do, as a profession, additional investigation before a uniform recommendation can be made for patients to use beta blocker medications. Not only do we need to be concerned about patients diagnosed with Duchenne's muscular dystrophy, but we need to be concerned about the cardiac health of other individuals in the family who are carriers of this disease. We are at our beginnings of our understanding about how carriers' cardiac function is affected long-term, and additional investigation needs to be undertaken. However, I think it's a prudent recommendation at this time that carriers of Duchenne muscular dystrophy undergo cardiac evaluation to ensure their long-term health. In patients with Duchenne's muscular dystrophy, I think that there are a number of dietary concerns that already need to be adhered to with regards to maintaining long-term overall health. These, I think, are adequate with regards to maintaining long-term cardiac health. Reducing the amount of sodium that a patient takes in will be of benefit to the heart long-term, as in any patient with cardiac muscle disease.